Catheter separation. Separate a patient from a closed catheter 1 after wearing sterile gloves. Touch a catheter separation button on the LCD screen and follow the orders of the pop-up screen. Once the button activates, a device removes residue inside of the catheters for 30 seconds. The pop-up screen will automatically disappear when it is done. Place the upper part of the closed catheter on the catheter support. Twist off the cap of a closed catheter on the back of the device and pull it up heavily about 20 centimeters using both hands. When you can see a connection between an aspiration catheter and a catheter reel, hold it with both hands and spin to separate the joint. After this, dispose of the catheters altogether. With wearing the new gloves, check an open marking of an LMO to set packaging, and take out the closed catheter 2 and the aspiration catheter. After putting the aspiration catheter aside for a moment, place the upper part of the closed catheter on the catheter support. Insert the catheter reel into a large middle hole of the closed catheter 2. At this time, it is important to press the closed catheter 2 on the device with force, while matching the embossing of the catheter 2 and debossing of the device, and turn the cap to connect it. Afterwards, touch the aspiration catheter exchange button to activate this function, which is making a catheter reel rise up outside of the catheter 2. Check the connection part of the aspiration catheter and tear the packaging partially. At this point, please keep in mind of tearing only small part of the packaging, because the inside of the packaging is supposed to insert into a patient, and it has always to be sterilized. Then, hold the connection of the aspiration catheter and the catheter reel with both hands and rotate it to join. It is easy to connect on condition that the aspiration catheter is straight, and you have to store it without any bending, as well. If you touch the aspiration catheter exchange button once again to switch off, the aspiration catheter goes into the inside of the catheter 2. Take out a closed catheter 1 from the LMO1 set. After checking the matching parts of the closed catheter 1 and to certainly press the catheter 1 and turn it to combine it. Check the blocking system message is supposed to stop immediately if the process is completed successfully. After replacing the catheters, the time setting on the screen is initialized, so reset is required before using it to the patients. After all the processes are over, you can connect it to the patient. Thank you for watching.